The contents of this video are for informational purposes only. It is not intended to be a substitute for professional medical advice. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or before seeking any new treatment.
Welcome to the First 9. This is Dr. Saul Weinreb with BabyCentral.com. Today we are going to talk about diagnosing infertility. So you and your partner have been trying to have a baby now for a year and you haven't been successful. So you come to the doctor and now of course you're concerned. What kind of tests is he or she going to do? What are they going to need to do to figure out why I'm not getting pregnant? Well, we're going to review some of those basic things on how infertility is diagnosed. First of all, the man needs to have healthy sperm. To work up a woman for a cause of infertility without analyzing the man's semen can turn out to be a major waste of time. That's because a semen analysis is a simple test that can be done in a laboratory and may identify an obvious cause for infertility. So one of the first things your doctor will order will be a semen analysis in order to make sure the sperm is healthy enough, motile enough, meaning it can swim well enough, and that there is enough of the sperm to help a woman get pregnant. The second thing the doctor is going to try to determine is, do you release an egg every month on time, meaning do you ovulate? Now 90% of women that have regular periods on a monthly basis do ovulate every month. So the fact that you have regular periods is a major piece of evidence and can be all the doctor needs to diagnose that you do indeed ovulate. However, there are some women that may seem to have regular periods that don't ovulate regularly. So there are various tests that can be done. Blood tests to find levels of progesterone, ultrasound tests to look for the developing follicle within which the egg develops, and other types of tests measuring the body temperature changes early in the morning when you wake up. These are things that can be done in order to confirm that you indeed ovulate and release an egg. The next step, since the egg needs to make it through the fallopian tube, is to do some tests to determine if the fallopian tube is open. The most common test is called an HSG. That stands for a histosalpingogram. This is an X-ray, but while you're getting the X-ray, your doctor will inject a special kind of dye through the uterus and through the tube, and he'll be able to see, or she'll be able to see, that the dye indeed flows through the tube and that it's open. If it's blocked, that may explain why you're having difficulty getting pregnant. In addition, a HSG may reveal a mass or something inside the uterus that would make it difficult for a pregnancy to implant. This also may be revealed on an ultrasound or even a physical exam in the office. Masses like fibroids or polyps and other uterine masses and problems can make it difficult and can also be part of the diagnostic process of getting pregnant. Occasionally, some other tests may need to be done. Sometimes a laparoscopy, which is a surgical procedure where the doctor looks inside your pelvis with a camera, and occasionally a hysteroscopy, where the doctor looks inside your uterus with a camera, may be necessary. And on some occasions, there may be other more rare tests involved as well, depending on your own situation. Remember, this video cannot replace a visit to your physician. Always consult a physician about your particular medical problems. This has been Dr. Weinreb with BabyCentral.com. Have a great day.